I'm Dr. Kelly Gardner. I'm the author of the book, Everything You Should Have Learned in Psychiatry School But Didn't. The book is written for clinicians and anyone that does work in psychiatry. I also have a website that you can see up above. I have free handouts that you can download to use for your patients and caregivers and loved ones to better understand certain mental conditions. Today, I'm going to keep this very brief because I know time is important to you. I'm going to talk to you about 3 medications that are pretty popular right now. They are Latuda, CAPLYTA, and VRAYLAR. These are things that you weren't taught in school, and sometimes the pharmaceutical reps won't tell you certain things because they're not allowed to. First, I would like to talk to you about Latuda. I call it Latuda the Buddha, take it with Fuda, because it doesn't cause weight gain. It will not increase blood sugar or cholesterol. I haven't seen anyone with any issues with prolactinemia either. It treats bipolar depression, and that's what I use it for. It also treats, I believe, bipolar 1 and schizophrenia, but at different dosages. I use 20 milligrams once a day. They have to take it with 350 calories or it won't work. I usually have them take it at dinner because it makes some people sleepy and they sleep better with it at that time. If you have a patient that isn't eating, that's not the pill to offer them. I mean, you can offer it, but if they're not taking 350 calories, it's not going to work. And they'll get very nauseated. The other thing you need to know is please educate your patients on akathisia, which means that they get inner restlessness in their bodies. I tell my patients, look, there's a thing called akathisia. If you get restlessness in your legs, you can't relax your body, your inner body feels like it has to keep moving, you can't just sit and chill. It's not anxiety. It's a side effect from the Latuda. So if that happens, I want you to take 2 of them once a day. If you can handle the akathisia, take 2 of them once a day, double the dose, and that should make it go away in a day or 2. If it's too miserable, just quit taking it. But otherwise, if you can stick it out, take 2 of them, and it should be gone in a day or 2. And most people do very well. But again, if it doesn't work, have them call you and just quit taking it. I wanted to let you know something about Latuda is when they had categories for pregnancy, I don't think they use them anymore. It was a category B, which was known to be one of the safer agents for pregnancy. However, keep in mind, I have a lot of patients where they're having unprotected sex, but they don't want to get pregnant. But I tell them if you're not using any protection, I have to assume that you want to get pregnant. And I have to put you on something that's the cleanest and safest medicine possible. So these are some options for you. And Latuda would be one of those options. And please note that on my website, there are pregnancy handouts. So if you have a patient that's pregnant, there's all sorts of handouts on there. And there's information on the pregnancy risk hotline that you can call to get more information should one of your patients be pregnant. But remember, always assume that they're going to get pregnant if they're having unprotected sex, even though they tell you they don't want to get pregnant and don't plan on it. The next medication is VRAYLAR. That is approved for bipolar 1 and schizophrenia. What you need to do is when you request it, sometimes you need prior authorizations for this medication. Don't put bipolar 2. I use it for bipolar depression. However, if you put bipolar 2, the insurance companies are going to deny it because it's not approved for that. So put bipolar NOS as an extra diagnosis in the chart. So when you ask that a medication be approved and you send in for a prior auth, make sure you put in bipolar NOS. Now, I do use VRAYLAR for bipolar 1 and 2, and it's also used for schizophrenia. I use for bipolar 2, I use 1.5 milligrams once a day. If they use marijuana, it can increase the risk I've seen personally of akathisia occurring. So again, you need to educate your patients on the akathisia. If it occurs with VRAYLAR, what you do is you have them take it every other day for about a week or 2. And some patients, I just start them out every other day for about a week or 2. And if they're okay, no akathisia, then go up to once a day thereafter. If they still have it or it's too miserable, quit taking it and call you. The next medication is CAPLYTA. Again, just like VRAYLAR and Latuda, no increase in blood sugar, cholesterol, no weight gain. It's a good medication. It treats schizophrenia, and I've used it for that quite well at the 42 milligrams once a day. And I also use it for bipolar 1 and 2. And if you're confused if somebody has 1 or 2 or they have a mixture of both, CAPLYTA, there you go. There are some lower doses coming out. I've not used them, and I don't know the data about them. 42 is the main dose. So what I do is I have people take CAPLYTA at bedtime. The reason why they need to take it at bedtime is one of the main side effects can be dizziness, like an hour or 2 after you take it. So the goal is they'll get that while they're sleeping until their body adjusts to it. The problem is if you have some old guy with prostate problems and he's getting up to pee 5 times a night, you might want to think again. Although I do have a lot of seniors on this medication and they're doing great. But just make sure that somebody's not at a risk for falling or anything like that. Again, these 3 medications do not increase blood sugar, weight, or cholesterol, but you have to tell them that and remind them that when they read the package insert, it says that it does. The problem is the FDA uses the same package insert for Zyprexa. I tell my patients, look, if I put you on Zyprexa, you might gain 10 pounds, your blood sugar and cholesterol might go up. It's the same package insert as it is for Latuda, CAPLYTA, and VRAYLAR. But these medications, the research supports that they do not cause these problems. So please let your family doctor know as well. And believe me, I've had patients with diabetes saying, Dr. Kelly, I had to go off it because my doctor said it would increase my blood sugar. No, and that's the problem. So make sure you tell your patients how it is. And that way they won't go off it with some confused information. I hope that these tips and tricks help you with these very popular medications. And please, when you're filling out your notes on your patients, always put down failed agents. I have a little section of failed agents. Oh, they got this from this from that, this didn't work. So if you have to do prior authorizations for these 3 medications, then you'll have a list of meds that they failed. So if someone at your office reads your notes, they can fill out the paperwork for you very easily. The other thing is Latuda, there's no more samples of that. It will be going generic probably, I think, in February, but I'm not sure. And again, when they go generic, you got to be careful because, you know, it's only 80% of what the original medication was. So you don't know what you're going to get. There's a 20% leeway there. Years ago, I used to use Abilify 15 and Seroquel XR300. They work great. My patients didn't gain weight. They didn't get diabetes. They actually lost weight. They did wonderful. But since those agents went generic, people are getting problems with them at low doses and things I've never seen before. So please keep that in mind. And I hope that this information helped you. Thank you for stopping by.